Rather than fold their arms and consign the fate of their nationals to the uncompromising and ruthless ravages of COVID-19, as some countries had inexplicably done, the statesmen and dynamic government agencies in many other nations had met the threats and challenges of the dreadful disease with robust measures and strategies. In Nigeria, one of the foremost government agencies that had and still continues to take the bull posed by COVID-19 by its horn is the country's apex bank, the Central Bank of Nigeria, CBN. Good evening. My name is Chinemerem Joseph, and it is my pleasure once again to welcome you to this edition of You and the Economy. Now, the focus is still health, and that is why I am presenting again from the National Hospital in the nation's capital, Abuja. In addition to the legion of economic measures structured and calculated to ameliorate the impact of COVID-19 on the economy and the citizenry, and which are basically focused on increasing and making access to credits easier, the CBN had also adopted interventions to tackle COVID-19 simultaneously, also from the health perspective ab initio. Now, this is because the CBN is aware that the adverse impact of COVID-19 is not limited to livelihoods alone. It does affect life too. So, rather than focus only on tackling COVID-19 by granting access to credits, one major intervention of the CBN to fight the virus taxes the intellect and creativity of talented and gifted Nigerians to deploy their endowments in the area of science to battle and subdue the virus. That CBN intervention is the Healthcare Sector Research and Development Intervention Scheme. The scheme is designed to promote research into COVID-19 with a view to promoting scientific inventions and breakthroughs to tame the disease. The Healthcare Sector Research and Development Intervention Scheme is the subject of today's edition of You and the Economy.
This event represents a significant milestone in the actualization of the unflagging resolve of the Central Bank of Nigeria, CBN, to contribute robustly to the fight against the novel coronavirus disease and in revamping Nigeria's troubled healthcare delivery system. Being presented with grant awards at this momentous event are 5 of the hundreds of researchers who submitted entries for grant awards under the CBN Healthcare Sector Research and Development Intervention Scheme. The presentations were made after the research topics submitted by the awardees were adjudged as successful by the body of experts, BOE, tasked with evaluating entries for the scheme. The Healthcare Sector Research and Development Intervention Scheme was formally unveiled by the Central Bank of Nigeria, CBN, in May 2020 as one of the interventions of the Apex Bank to cushion the devastating effects of the coronavirus disease after its outbreak in Nigeria earlier that year. Unlike the CBN's Health Sector Intervention Fund featured previously on this program, that was rolled out in March 2020 and which seeks to ameliorate the impact of COVID-19 by providing repayable loans to eligible parties in Nigeria's healthcare delivery system, the Healthcare Sector Research and Development Intervention Scheme confronts the disease by offering grants to researchers to drive scientific efforts and innovations to rein in the disease. According to its framework, which was released in May 2020, The scheme is being funded from the development component of the Micro, Small and Medium Enterprise Development Fund, MSMEDF. The broad objectives of the scheme include providing grants for research and development in new or revalidation of drug molecule, phytomedicines and vaccines for the control, prevention and treatment of infectious diseases in Nigeria. Boosting domestic manufacturing of validated drugs, herbal medicines and vaccines for the control, prevention and treatment of infectious diseases in Nigeria, and reducing the nation's dependence on other countries for these drugs and vaccines. Improving the capacity of biotechnological and pharmaceutical companies, institutions, researchers and research institutes in the development of approved Nigerian drugs, herbal medicines and vaccines for infectious diseases. Supporting capacity of relevant health agencies towards attaining World Health Organization's WHO Maturity Level 3, which is a prerequisite for the manufacturing of vaccines in Nigeria. Facilitating partnership between academia, that is, researchers, research institutes and universities, and industry into the research and development of drugs, phytomedicines and vaccines for the control, prevention and treatment of infectious diseases in Nigeria, and reduce dependence on imported drug products, both synthetic and herbal, and vaccines for the control, prevention and treatment of infectious diseases in Nigeria. Research and development activities eligible for consideration under the scheme include research and development of candidate drugs, herbal medicines and vaccines validated by relevant health authorities for the control, prevention and treatment of infectious diseases. Manufacturing of drugs, herbal medicines and vaccines validated by relevant health authorities for the control, prevention and treatment of infectious diseases. Research partnership between academia and industry into the development of drugs and vaccines for the control, prevention and treatment of infectious diseases. And research and development into validated phytomedicines for the control, prevention and treatment of infectious diseases. The grant limit of the scheme is determined by its two components, namely research activities and development/manufacturing activities. For research activities, the grant limit is 50 million naira, while the ceiling for development/manufacturing activities is 500 million naira. Disbursement under the scheme shall be made to beneficiaries in tranches subject to approved milestones achieved. A time frame was also attached to both research and development activities under the scheme. For research activities, the time frame is not more than 2 years from the date of release of fund, while development/manufacturing activities are expected to be completed successfully within a time frame of 1 year from the date of release of fund. A committee known as Body of Experts (BOE) is tasked with administering the scheme. The BOE is responsible for the review and evaluation of submitted research proposals, as well as recommending the financing of research and development projects with high potential to contribute to the development of the Nigerian vaccines for infectious diseases. The body of experts is headed by the Director General of the National Agency for Food and Drug Administration and Control in Nigeria, NAFDAC, Professor Mojisola Adeyeye, a pharmacist of international repute. Members of the stellar cast body, alongside Professor Adeyeye, are Professor Babatunde Lawal Salako, Director General of the Nigeria Institute of Medical Research, NIMR, Professor Richard Adegbola, a Fellow of the Nigerian Academy of Science, as well as Lead Consultant and Research Professor with the NIMR, Alex Akpa, Professor of Pharmaceutical Microbiology and Biotechnology, Isa Marte Hussaini, Professor of Pharmacology and Fellow, Nigerian Academy of Science, and Abdul Hamid Ahmed, Associate Professor of Medical Parasitology, whose areas of research interests include infectious diseases, epidemiology, biomedical science, and tropical diseases. Others are Dr. Chinwe Lucia Ochu, Acting Director of Preventive Disease, Prevention Program, and Knowledge Management, as well as Head of Research, National Center for Disease Control, NCDC, and Dr. Philip Fafawora Builders, Associate Professor, Department of Pharmaceutics and Pharmaceutical Sciences, Kaduna State University, Kaduna. The implementation of the CBN Healthcare Sector Research and Development Intervention Scheme was set in motion with the inauguration of this body of experts July 2020 in Abuja by the Secretary to the Government of the Federation, Boss Mustafa. Only 6 months after the scheme's body of experts was inaugurated, the CBN demonstrated its avowed seriousness and commitment to the worthy objectives of the HSDRIS when the maiden grants of the scheme were formally awarded to successful applicants. Following the receipt of over 286 proposals from the general public and a thorough evaluation of a short list of 68 of those submissions by the scheme's body of experts, 5 of the submissions that were adjudged as having significant merits and which were valued at 253.454 million naira were commended by the body of experts for financing. The 5 successful applicants were Professor Olufemi Emmanuel Dokun Babalola, Professor Ikechukwu Okoli, Dr. John Ogedengbe, Mr. Garba Uba, and Dr. Ortega Ejofodomi. Dokun Babalola, a professor of epidemiology and ophthalmology, is a fellow of both the Postgraduate Medical College of Nigeria and the West African College of Surgeons. He is also the head of the Guild of Medical Directors, a body of private medical directors, as well as the founding dean of Clinical Sciences, College of Health Sciences, Bingham University, Karu, the satellite town of the federal capital, Abuja. Professor Dokun Babalola is a team lead of a body whose research topic is titled Randomized Clinical Trial Assessing the Efficacy and Safety of Ivermectin in COVID-19. The award amount is 50 million naira. The grant award was presented by the Secretary to the Government of the Federation, SGF, Mr. Boss Mustafa. Dr. Ikechukwu Okoli is an Associate Professor of Medical Microbiology, Department of Microbiology, Nnamdi Azikiwe University, Awka, Anambra State. An author of multiple research publications, Dr. Okoli also heads the Biosciences Research Support Foundation, a non-profit organization focused on raising support for Nigerian scientists working in the fields of biological, medical, and biomedical sciences. The research topic of Dr. Okoli's HSDRIS submission is development of a rapid urine test for Lassa fever diagnosis, and the award amount is 50 million naira. Minister of State for Health, Senator Olorinimbe Mamora, presented the grant award to Professor Okoli. Garba Uba, who at March 2021 was PhD in view, is a senior lecturer at the Department of Science Laboratory and Technology, Jigawa State Polytechnic, Dutse. He is author of more than 20 research works, including a co-authored work titled Predictive Mathematical Modeling of the Total Number of COVID-19 Cases for Brazil. Uba's submission earned him a grant award of 42,144,223 naira. The symbolic check for the award was presented by the chairperson, body of experts of the CBN HSDRIS, Professor Mojisola Adeyeye. Dr. John Ogedengbe is of the Department of Human Physiology, Faculty of Basic Medical Sciences, College of Health Sciences, University of Abuja. He is a co-author of a research work on the changes in disease burden from communicable diseases to chronic non-communicable diseases, published in 2014. The amount of Dr. Ogedengbe's grant award is 50 million naira. His award was presented by the governor of the CBN, Godwin Emefiele. Dr. Ortega Ejofodomi is lecturer grade 1 at the Federal University of Petroleum Resources, Efurun, Delta State. A registered engineer with the Council for the Regulation of Engineering in Nigeria, COREN, as well as member of the Institute of Electrical and Electronic Engineers and the Society of Petroleum Engineers, Dr. Ejofodomi is also involved in an organization that specializes in computer programming, automation, Internet of Things, cloud solutions, and artificial intelligence. Her grant award for the sum of 40,400,000 naira was also presented by the CBN governor. In his welcome address at the formal presentation of the grant awards, Governor of the CBN, Godwin Emefiele, described the event as a testimony to the significant roles that research and development in healthcare could play in supporting economic growth, especially because economic growth is highly dependent on a strong and healthy workforce. Emefiele urged the private sector to collaborate with the CBN in funding research for the good of the nation.
Meeting our need for a strong and healthy workforce with better safety profiles is a task that can only be addressed through a healthcare sector that provides for significant investments in research and development. A vibrant and innovative healthcare system is also vital for our national security. We all witnessed how a number of countries and territories adopted stringent and immediate export restrictions on critical medical supplies and drugs that were specifically meant to help countries respond to the spread of this virus.
Speaking further, Mr. Emefiele congratulated the first batch of awardees for their successful submissions. He revealed that the review of proposals submitted by applicants for the grant awards was still ongoing, adding that the CBN expects the body of experts to provide additional recommendations for the presentation of more grant awards to a fresh batch of successful applicants in due course.
I'd like to urge the recipients of these awards to judiciously utilize the opportunity afforded them by the CBN and strive to achieve the purpose for their research by ensuring that their projects meet the set targets, aims, and objectives of supporting the development of vaccines and drugs in Nigeria. Let me say that everybody will focus on you. They'll be following you, the award recipients, to know how far you have gone in actualizing your research proposals. And I want to wish you well, and because you are just about, I'll say you are the first set of people that are coming on, it is important that you set a pace that others can follow. And please utilize these funds judiciously. They may look small, but at least we begin a journey today. It is my strong belief that this will offer the average Nigerian access to much needed vaccines and drugs for not just COVID-19, but other communicable or non-communicable diseases.
In his address of goodwill, Secretary to the Government of the Federation, SGF, Boss Mustafa, was delighted that the CBN Healthcare Sector Research and Development Intervention Scheme is designed to strengthen Nigeria's public healthcare system with innovative financing of research in new and improved drugs, vaccines, and diagnostics of infectious diseases, and assured stakeholders of President Muhammadu Buhari's support for the initiative. The SGF said that with the rollout of COVID-19 vaccines on the global scene, steps such as the grant awards instituted under the HSDRIS, which aim to, among other things, develop vaccines, are laudable because Nigeria cannot afford to endlessly depend on other nations for COVID-19 vaccines.
This gesture of making funds available for research and development in the healthcare sector would not have come at a better time. than now. We need to boost our healthcare system to be able to withstand pandemics and any health-related emergencies that will come. With the arrival of vaccines, there is now need for us to develop on how to mass produce these vaccines in country and other medical items for the use of our populace. We cannot continue to depend on importation of vaccines. I believe that we have an opportunity of turning the tide at this moment.
Also speaking at the momentous event, Minister of State for Health, Senator Olorinimbe Mamora, described the grant awards as a testimony to the creative policy of the Buhari administration and the support the government has offered to Central Bank of Nigeria to carry out a statutory responsibility. Senator Olorinimbe Mamora, himself a medical doctor, said having subjected them to scrutiny, the objectives of the HSDRIS, its eligibility criteria for accepting research proposals, and the composition of the body of experts that scrutinize the proposals submitted, all have his full endorsement, adding that he had no doubt that the body had done a great job. The Minister of State for Health was hopeful that researchers will take advantage of the grant awarded under the HSDRIS to provide Nigeria with indigenous drugs that can control COVID-19 infection and possibly other infectious diseases and non-communicable diseases alike.
The global impact of COVID-19 pandemic on the economic and health of the nation is evident to all of us. And this symbolic intervention is a step in the right direction to our dear nation. Boosting the morale of our own researchers will create a value chain that has ripple effect in terms of more jobs for our citizens, significant decreased over-dependence on advanced nations for vaccines and other important drugs, and we can start to reduce the huge capital flight involved in procuring vaccines and other drugs from foreign countries. Dear colleagues and researchers, I am particularly glad that the much needed support is being provided, and it can stimulate your capacity to develop indigenous vaccines and other critical healthcare needs to mitigate capital flight occurable as a result of importation.
In an interactive session with the media at the end of the award ceremony, chairperson of the body of experts charged with evaluating the submissions for the grant of awards under the HSDRIS, Professor Mojisola Adeyeye, said her committee was not through yet with the review of submissions and gave assurance that more grants will still be awarded in the foreseeable future.
This is a big stepping stone for research and development in Nigeria. CBN has supported research and development. We are seeing just the output of it. It's an encouragement to my young colleagues that got the award. What CBN is doing is fantastic for the country and is going to move us forward in terms of health security. Without health security, we cannot have a healthy workforce.
In due course, and as opportunity permits, you and the economy shall provide you with updates on the progress made by the grant awardees in the pursuit of their research topic and what that holds for both the fight against COVID-19 and the continued success of the CBN Healthcare Sector Research and Development Intervention Scheme.
Now, much as COVID-19 is almost always associated with gloom, doom, and despair, especially when people lose beloved ones to the deadly disease or have their life savings depleted in treating the ailment. The CBN has shown that with ingenuity, smart vision, and creativity, the immensely disruptive and deadly impact of COVID-19 on society in general, as well as the challenges and threats it poses to public health, lives and livelihoods can otherwise be tackled to yield positive ends, even as the monstrous disease itself is effectively tamed. This has been demonstrated by the CBN through its healthcare sector research and development intervention scheme. Given what we have seen on this edition of the program, the CBN Healthcare Sector Research and Development Intervention Scheme is a step in the right direction, as it has already begun to yield dividends. It is on this cheerful note that we sign off on this edition of the program. Please to join us again, same time next week for another edition of You and the Economy. Until then, it's bye for now.